The original definition comes from two American academics, Robert Granfield and William Cloud, who defined recovery capital as the strength and breadth of internal and external resources available to an individual to support their recovery journey.
Recovery really exists, and that recovery is not an easy process. It's not a process that we can say, okay, today you are starting and in the 2 years you will be finished with your recovery. So recovery is really not a linear process. It's up and down, but and exist. So this is the most important message. So people can recover it through the different kind of support and tools that they will get on their journeys.
The conceptual boundaries of recovery have gotten kind of fuzzy over the years. But when I think of recovery, I think of people's full functioning restored. And in collegiate recovery, we talk about people getting better than well. And I think that's one of the reasons I've loved working in addiction treatment, over 28 years, because we get to see people who are really severely impaired by their addiction. And a year or two later, their lives are completely transformed.
And what's interesting about stigma is it operates at all three levels. So at a personal level, self-stigma is the internalization and the disempowerment caused by the internalization of stigma. Negative social recovery capital around stigma would be about the exclusion and demonization of the groups you belong to. And then negative community recovery capital as stigma would be about we don't offer treatments to drug users. We don't offer treatments to drinkers because they are seen as lesser or excluded or marginalized. Social capital, human capital, recovery capital, they're not like financial capital because the more of it you use, the more of it you generate. When we cultivate recovery capital, it should benefit you as the individual on a journey, but it should also benefit the group and the community in which it occurs. It has that kind of positive ripple effect, but it's bi-directional and it goes both ways. We can't assume that the recovery journeys of men and women are the same. We can't assume that recovery journeys are the same across locations. There's much more of a specificity.
We cannot consider only our way is the right one. We need to accept other recovery paths. So when we are working, we really want to hear different recovery paths and to support that. And this is not easy thing to support different recovery paths, but we want to see people developing in their lives. We cannot say my way in Bosnia, in Serbia and Croatia is the best way. Then we need to think, okay, somebody from United States has a totally different background. He's culturally different and he grew up differently and now he's recovering differently. If we think what was 10 years ago, people knew only that recovery is something what is truly abstinence-based, etc. They didn't realize that recovery is some process that can even exist in the hospitals, that can exist in the communities, that can be supported inside of the family. So everybody is a recovery provider.
I think recovery is just as important or more important than ever, which isn't to say that harm reduction isn't important and isn't essential, but I view it as one part of a continuum.
And as far as my own personal recovery, my journey, being able to talk to others from across the globe as well that are sharing their stories just fills my tank up and makes me stronger as well in my own recovery because it is better together.
In terms of, we are constantly thinking, what is the best way and the most engaging way to take the science, which, hey, I'm a scientist. I'm not talking, any crap about science. I love science, but it could be dry and overly technical sometimes. And for it to be able to really reach and engage the general public, we have to translate that into formats that are more engaging and just more consumable. We're trying to figure out what is the best way to take the science and really engage people. We do have these bulletins, but there's a lot of text there, and we try to create as many visuals as possible, but we're starting to think about video and how can we use video, and what are the best ways to use video and audio, and then with text maybe in that context too, to really engage multiple stakeholders in multiple different ways. So I think that's what I would say, and I do think I speak for all of us. That is on the public health initiative side of what we do, and we're really trying to work on that. Is to
addiction treatment has in the United States, I don't know what it's like, in Europe and elsewhere, but in the United States had a long tradition of doing things the way we'd always done them, and sometimes uncritically. And I really wanted the staff at Dawn Farm to be very well informed about what was going on in terms of drug policy and in terms of research, and to understand why we did what we did at Dawn.
Really unique for our Balkan region, because we developed website as a response of the so many news that we are reading about the drugs, which are totally something what is not giving us knowledge about.
Me, I wanted something that links much more closely to the work of the College of Lived Experience Recovery organization, much more ground level, to talk about things like that are just new and innovative and I think are really exciting.
We're here to lift up the great work that is going on around the globe, with hopes to help educate our listeners and also inspire our listeners, and maybe even encourage a few new connections, collaborations, and partnerships, because prevention is better together.
We can remind ourselves, okay, this is a recovery month. It's something that we need to spread even to the key stakeholders and to tell them recovery exists, and to repeat and whole year, not only through the recovery month.
Recovery month is such an important celebration of achievement and goals.
Recovery is possible, and I think that gets obscured, particularly as systems of care don't offer treatment and recovery support of adequate quality, duration, or intensity. And we get outcomes that reflect that failure, those systemic failures. And then people start to think that recovery is impossible and kind of lower the bar.
We are more likely to be able to make the largest impact when we all work together, right? And figure out like what's our common ground. And if we do have differences in terms of how we want to approach this, talking about those differences, figuring out where we do have common ground, and establishing some consensus for the greater good. That's part A. And part B is, I just sort of said this, I think science has a role in this.
So for the organizations, it's along that same lines. Together is better. Get out, engage with others, with other organizations, with other subject matter experts, and of course, those in recovery, to learn from each other, so we can also better support each other, because we're all in this together. There's a quote that I just hold true, that is my sort of guiding compass, that reminds me to keep me on the path and bring back some strength. And it's that from Mahatma Gandhi, that every worthy act is difficult. Ascent is always difficult. Descent is easy and often slippery. So remember, it's that ascent. It's going to be difficult, but it is oh so worth it.